Hello, students. I hope all of you are fine. I'm Jasmeet Kaur. As we have already covered two questions in the Unit 1 in the last lectures, and that were meaning and definition of psychology with schools of psychology and scope of psychology. In today's class, we are going to discuss about the different methods of psychology, means how can we study the behavior of a human being by using different techniques or methods. And in the last, we will be discussing upon the relevance of psychology in nursing. That means how psychology is important for you in your nursing profession. So let's start with the methods of psychology. Now, as we have already discussed or studied that psychology is a scientific study of human and animal behavior, and I have already told you that if I want to study the human behavior in depth, for that we need to study motor activities, cognitive activities, and emotional activities. To study all these activities, we need to find out some special tools and procedures that are going to help us in collecting the different subject matter, and so that we can study the behavior of different human beings in depth. The methods that we can use to study the behavior of a human being, these there are many methods. First one is introspection method, observation method, experimental method, clinical or case history method, rating scale, checklist and questionnaire method, and testing method. Let's start with the first method, that is called as introspection method. Introspection method is also called as self observation. If I'll ask this question from all of you, that what is the meaning of introspection, let's divide this introspection in two. Introspect. Intro means related with the self, spect means search. So basically, the meaning of introspection is self search or look within. There is a one quote that is given by Aristotle, that knowing yourself is the beginning of all wisdom. To understand others in a better way, first of all, we need to understand ourselves. So, in this introspection method, we are going to look within so that I can get the knowledge about my own mind, my own feeling, and my conscious level. Introspection method is one of the oldest method of psychology, and this is very special to psychology also, as we have already covered this thing in the schools of psychology also, that introspection method was given by William Wundt, who opened first psychology laboratory in USA. So, the meaning of introspection is looking within. That means in this method, we are going to look within, and we are just going to work upon our own minds, and we can just find out there that what is going inside me. And in other words, this is a method of self observation. That means in this method, I am going to observe my own mental state either directly or by the use of my memory. Here, I am going to give you one example to understand it in a better way. Let's say that as a student nurse or as a staff nurse, you are near to your patient who had just gained consciousness after a surgery. Now, as a nurse, when this person is coming in the consciousness, you can ask from this patient that how are you feeling now? Now, what this patient is going to do? This patient is going to look within, and, like, for example, if this person is just going into you ask this question from me, I'm just going to look within that. Oh my god, what exactly happened with me? Oh, I was having this problem, and then I went for the surgery. I was under the effect of anesthesia, and right now whatever this patient is going to feel, he is going to give us the report. So that means in making all these things, the patient used this method, self observation. With the help of observation method, we can assess someone's feelings, uh, consciousness, and you can say your own mental state. Then with the help of this method, basically this is very helpful method if I want to know about me. I'll just simply sit and I'm just going to observe myself. I'm going to check my own memory. I can check my own feelings. I can assess my own consciousness. So introspection is very special method to psychology. If we are going to talk about the advantages and disadvantages of this method, let's talk about the advantages first of all. This method is very useful because with the help of this method, it is going to help us to understand about ourselves. And on the other hand, if I am going to ask one question from other person, this person is going to observe himself, and whatever he or she is going to feel, he is going to tell us the exact information. So that means it's called face to face interaction, and the person is going to tell us what exactly is going inside the mind of that person. Second advantage of this method is it does not entail any expenses. That means there is no need of any laboratory, there is no need of any test. Whatever I want to know about that patient or person, I'll simply go to that person and I'm going to ask some question. So there is no need of any laboratory or apparatus. So that is also a positive point. And moreover, we can obtain a direct knowledge of the mental experience of an individual. Means whatever I want to know about that person, I can directly ask and will be able to know about that person. Now, if we are going to talk about the disadvantages or limitations of this method, then it is not applicable on animals, children's, and mentally challenged patients because they cannot introspect. Let's say that I am going to an animal or a child, and I'm going to ask from them that how are you feeling, and they can do introspect, mentally challenged, and if they are going to tell us, we just cannot you can say rely on that information. So that is why this method is not applicable on children's, animals, and mentally challenged people, and it may destroy the very experience or the process it aims to study. The sometime the person to whom I am asking question, it may be that internally he or she is feeling in a certain way, but directly he is not able to tell me the exact information, right information, and in that case that can affect the results. Here's an example that it may be that there's an individual, there's a person, it may be that he is very angry at that time. If we are going to ask from him about the reports, how he or she feels, immediately when he start looking within, it may be that he is going to change his mindset a bit, then he is going to give me the answer in a wrong way. So that means this method is not much applicable. On the other hand, there is one more disadvantage of this method, because we are saying that for this method we don't need any laboratory, we don't need any apparatus. So that means this method is not a scientific method. So this is also one of the limitation or disadvantage of this method. I hope introspection method is clear to everyone. Then the second method is observation method. This is also called the method of objective observation. This is completely opposite to introspection. That is a method of self observation. So basically, in the introspection method, the person himself observe. But on the other hand, in observation method, we require two people. One is observer, second is subject. The observer is going to observe the behavior or the different behavioral patterns like bodily changes, their actions, their gestures, postures, facial expressions, their speech, how this person is going to express himself or herself. That means the observer is the person who is going to observe the behavior of the subject. Now, if I'll say that how we can conduct this method, in observation method, first the most important thing is that whenever we are going to conduct observation method, we are not going to tell this thing to the subject. That means observation method should always be conducted in its natural setting. Let's say that when a nurse is asked to give an observational report on a patient who has been admitted to the ward for an undiagnosed illness, then she can use this method. For example, when she was just taking the patient's, making the patient's report, like what is the name of the patient's, what is the temperature, during the taking the case study, she can observe the facial expressions, eye movement, gesture, posture, the ratio or the pain level of the pain. So that means whenever we are going to talk to any person, we are not going to tell to that person that look, I am observing you. We conduct observation method in its natural setting. This is one of the most important. It may be that this question come in your objective questions, like yes, how observation method should be conducted. So you must always know that observation method should always be conducted in natural setting. Now, if we talk about the advantages of this method, when we discuss about the disadvantage in introspection, we said that this method is not applicable on children's, animals, and mentally challenged people. Observation method is highly, greatly useful in the studying of these three. Means with the help of observation method, we can study animals, we can study mentally challenged people, and we can study children's also. If I am going to talk about the observation method in more detail, you just need to keep one thing in your mind, that observation method is just like an art. A person who is an artist, who, let's say that he's a singer or a painter, or it may be that he or she plays music, so, or a classical dancer, whoever is that person, if he or she wants to perform in a better manner, for that it requires a lot of practice, means an hours or hours of practice. Similarly, observation, if you want that your observation should be accurate, then you should practice a lot. Means we are going to observe more and more and more people in our life, so that, and the most important thing, like if I want to learn how to paint, for that I need some colors, I must have as an imaginative mind. Similarly, when I am going to observe a person, then what kind of mindset I must have. So observation should be always free from any judgment, any belief system. It should always be free from all these things. Means basically, whenever I am going to observe any person, I am not going to use my own experiences, I am not going to use my own judgments, my belief system, because we must understand this thing that every person is unique in his own way. So if XYZ person is reacting in a certain way, there is some reason. We must try to understand that person. Only then we can say that observation method is absolutely right in its own way. Then the third method is clinical or case study method. See, it's clear from its name, and this is one of the most recent and challenging method of studying behavior. This is mainly used by clinical psychologists, psychiatrists, social workers in child guidance clinics or mental hygiene clinics. Now, the question is, how can we use this method? See, clinical means abnormal, means the person who is having some kind of mental health issues. Case study means I am going to take the overall history of that person. And if I want to understand that what is the cause of this person's problem, like why this person is having some kind of fear, phobias, anxieties, or some kind of mental disorders, to understand him or her in a better way, we can use this case study method. Now, how to use this method? Let's say that XYZ person came to me, and I am going to use this case study method to study his or her personality in a better way. Then, first of all, I am going to collect the overall history from the person himself. Means I am going to collect the each and every information about that subject, but I cannot rely 100% on the information that is given by the client. To understand him or her in a better way, I must collect the information from the client's parents, his or her family members, society, school, teachers, and friends, and many more. Means the person, wherever this person is going, or wherever he has been, he then we are going to just collect the history. If you remember, in the Bhool Bhulaiya movie, this person, Akshay Kumar, he was playing the role of a psychiatrist in that movie. To understand the problem of Vidya Balan, he just went everywhere. He just, first of all, he was just trying to read the expressions. He wanted to know about that lady Vidya Balan, and then he was just exploring more and more about her, so that he can understand her in a better way, to understand his or her personality. So that means clinical or case study method is very useful method in its own way. No doubt this is very time consuming method, because this requires case histories, interviews, visits to the home, school, college, and use of many psychological testing. So this is very time consuming method, very energy consuming method, but once if it is done correctly, this is one of the most useful method for the patient itself. And it is an individual study method, because we cannot use this clinical method at one time for the many people. Means at one time we can study only one person. Then the next is rating scale, checklist, and questionnaire method. Rating scale, basically, in this rating scale we have a list of questions, and we are going to ask some questions from the clients or the patients, and whatever answers they are going to give us, we are just going to rate the answers of them, and then accordingly, wherever they are going to uh, place, accordingly we are going to tell them that this kind of trait you are having in your behavior. Then in the checklist, the psychologist is going to provide a list of traits or list of qualities to the client, and the subject is going to just simply mark or check, or it may be that by ticking, it may be that by underlining or by circling. The then student is going to the client is going to submit the report to the psychologist, and whatever quality the person is having in his or her behavior, the psychologist is going to tell them accordingly. And on the other hand, in the questionnaire method, see, it's clear from its name that in the questionnaire method, there will be a list of questions, and the psychologist is going to provide that questions may be in the written form or in the printed form. The psychologist is going to give that list to the clients or the person, The person is going to answer each and every questions, and it may be that the question he or she need to tick by ticking or underlining again or by circling. Then the investigator is going to count the number of each answer, and now accordingly whatever traits or responses the person is going to give, accordingly the psychologist is going to provide them their ratings. Then in the testing method, it's clear from the name there are different kinds of tests in psychology, like aptitude test, achievement test, intelligence test, personality test, intelligence test. Whatever traits we are going to assess for in the person's behavior, we are going to apply the same kind of test. For example, if I want to assess someone's personality, then I am going to use personality test on that person so that I can assess personality of that person in a better way. Similarly, if I want to assess the intelligence of a person, then I am going to apply intelligence test on that person to assess his or her intelligence. Then the last method is experimental method. See, this is one of the oldest method in psychology, and it was made popular by a German psychologist named William Wundt. We have already discussed about this person who opened first psychology laboratory in USA. And see, if we are going to understand this method in a better way, first of all we need to understand four key terms. First is the experimenter, subject, laboratory and apparatus. If we will be able to understand these four key terms, then we will be able to understand experimental method in a depth way. Experimenter is the person who is going to conduct the experiment on the subject. Second term is subject. Subject is the person on whom the experiment will be conducted. Laboratory is the place where an experimenter is going to conduct the experiment. Apparatus are the things or the instruments that an experimenter is going to use during the experiment. I hope these four key terms are clear to everyone so that we can move ahead in this experimental method. Now, on the basis of these four key terms, let's define it. So now, experimental method. See, I'm just going to repeat it again. Now, four key terms are experimenter, subject, laboratory and apparatus. We are just going to combine all these four key terms and we are going to define experimental method. So experimental method is that method in which an experimenter is going to conduct an experiment on the subject in the lab by using apparatus. The last word is under controlled condition. So see, this is very simple definition now, that there will be an experimenter who will conduct an experiment on whom the subject in the laboratory by using apparatus under controlled condition. I hope this will be easy to understand now. Now, this was all about the meaning of experimental method. Now we are going to study that how can we conduct this experimental method. For example, if I want to study someone's by using experimental method, then what are the steps? For that we need to follow some steps, in which the first step is problem statement. First of all, whenever we are going to conduct an experiment, for example, I am the experimenter, I want to conduct an experiment to study someone's behavior, then the first thing I need to do that is to find out a problem. Means I am going to decide what exactly I am going to do in my experiment. Now, because we are studying this in psychology, and psychology means the study of behavior, now we are already aware about this thing, that to study behavior it requires we need to study different behavioral patterns. For example, intelligence, personality, attitude, aptitude, learning, memory and many more things. Now, first of all, I need to decide what exactly I want to study in that person's behavior. Here I am just taking one example so that you understand it in a better way. Suppose I just made one problem statement that I am going to study the effect of room temperature on the learning capacities of BSc nursing students. So this is what I made, that is the my problem statement means I am going to assess the effect of room temperature on the learning abilities of BSc nursing first year students. After making the problem statement, I'll move towards the second step of experimental method, that is hypothesis. Hypothesis can be defined as the presupposed solution of the problem. Presuppose means we are going to assume the answers of our problem. Like, and I'm just going to correlate the same with the example. For example, I made this statement that to study the effect of room temperature on the learning abilities. For that, I can make two hypotheses: extremely high or low room temperature is going to affect the learning abilities on the of the students, or normal room temperature will not affect the learning abilities of the students. Then after developing the hypothesis, after making the hypothesis, we are going to move towards the third step, that is the variables. Variables are defined as the factors that an experimenter is going to use in the experiment. These are of two types: dependent variable and independent variables. Dependent variables are those that are under the control of the experimenter, sorry. It means an experimenter can do any kind of manipulation while conducting the experiment. So in this our problem statement, room temperature is the only thing where an experimenter can do any manipulation. So in this, room temperature is going to be the dependent variable. Independent variable that are not under the control of the experiment. It means the experimenter is not going to do any kind of manipulation during the experiments. For example, in this experiment, I am going to conduct the experiment on the students. I am going to plan for their seating arrangement, light, air, their study material. So to do this in a better way, I am not going to change all these things. Me, the students of BSc nursing will remain same for their sitting, everything will remain same in the whole experimental process. So that are called as the independent variable. Then in the fourth step of the experimental method, we are going to conduct the direct experiment on the subject in different settings. Then after conducting the experiment, we are going to make the results and discussions. Means I am going to collect all the results from the subjects, and accordingly I am going to do my I'm going to apply my statistical manuals, and then whatever results will come, I am going to do the analysis and conclusion. After making the results, the experimenter is going to compare the results with the hypothesis, that so that we can understand that whatever hypothesis I have made, the results were similar to that or not. So this is all about experimental method. If I am going to conclude this experimental method, see, experimental method is one of the most important method in psychology. This is the I can just say this, that this is one of the most important method. Why? Because we are going to conduct direct experiment on human beings to study them. And second importance is that because we are conducting this method, we are just conducting experiments on this method, so that means this method is scientific. Third, when I am conducting any method in the lab, the results obtained by this method will be more reliable, more specific, and more valid. So there is only one limitation in this method. That limitation is that human mind. That means everything is okay. I can control each and everything, but I have already told you that a human mind takes 60,000 thoughts in a day. When I am taking 60,000 thoughts in a day, it may be that during the experiment, room temperature was not affecting their results. On the other hand, in one of the day of your experiment, it may be that your mindset was not good. It may be that you are having some problem in your mind, you are having some kind of stress in your mind. So that means in that case, room temperature was not the thing that was affecting your result. That was your mindset that was affecting your results. So this is the only one limitation of this method. Otherwise, the results obtained by this method are more reliable, more precise, and more valid. Means we can just trust on these results. So this is about the methods of psychology. And now we are going to move towards the last topic of this unit 1, that is the relevance of psychology in nursing. Now see, we have already covered many things in unit 1 about this background of psychology. Basically, like first of all, what was the earlier meaning of psychology, then how this psychology was growing up by studying different history, by studying different schools of psychology. Now we are already aware about this thing that in psychology we are going to study human behavior, and we can use psychology in many areas. When we are already aware about this thing that psychology is very helpful in many areas, so that means similarly it is also helpful for us in our nursing profession also. Now we are going to study how this is important for us in our nursing profession. See, nurses are always working with people. I know that whenever this word nurses came, the first person came to your mind, that is a patient. This is very natural also, because nurses means the person who is just going to take care of the patient. But it is not limited to your patient only. You must keep this thing in your mind, that first of all, when you are going to become a nurse, or it may be that right now you are a student nurse, in future you are going to become a professional nurse. Wherever you are going to work in future, it may be in the college or in the hospital area, wherever you are going to work, first of all, you need to work on yourself. So there are many areas where psychology is useful for you. Means the psychology is important in the nursing profession. The first area where we can say that psychology is going to help us to understand ourselves, means it is going to help her to understand herself. When we are saying that in psychology we are going to study human behavior, so that means with the help of this subject, the student nurse or a staff nurse will be able to understand herself in a better way. Means how he or she can improve her personality, how she can channelize her emotions, how she can work on her motives or ambitions. It may be that she is suffering from some kind of fear or phobia. It may be that she is having some kind of trauma in her life. So, when she will start studying psychology, slowly and gradually, she'll be able to understand herself in a better way, so that she can develop a good personality for her own self, as well as for the others. uh, when a student nurse is going to understand herself in a better way, only then she will be able to understand her patient and other people in a better way. The second point, psychology is going to help us to understand others. See, I have already told you that when you are going to understand yourself, definitely you will be able to understand others in a better way. When you are going to assess your feelings, when you are going to assess your motivations, when you are going to understand that why am I feeling low today, how I can adjust myself in different situations, how I can assess my personality, what kind of personality I have, what kind of motivation level I have, what are my learning capacities, what is my memory level, what is my intelligence level, why I was behaving in a certain way. So then, slowly and gradually, when you will start developing an understanding about yourself, then you will start developing the same kind of understanding for the others, because you need to know one thing, that you are going to deal with many of the people in future. That is not only with the patients, you are going to deal with your family members, with the people with whom you are going to work, study, or live. You are going to deal with the doctors, other nurses, patients relatives, dietitians, psychologists, many more people in the hospital setting, class 4 workers even. So when I am developing that deeper understanding for myself, slowly and gradually you are going to develop the same kind of understanding for the others. You'll be able to understand that if XYZ person is behaving in a certain way, yes, I also behave in a certain way sometime, then it will be very easy to just understand that patient and accept that person in a positive way. So basically, psychology is going to help you to understand yourself as well as to the others. Then the third point is that psychology is going to help to appreciate the necessity of changing the environment. When you will start studying psychology, you'll be able to understand when and how to change the environment. Means you will be able to understand that yes, right now, why am I feeling in a certain way? I think I am getting bored, or I am just getting stuck. I think now I should change my surroundings. Similarly, you can just simply help the other people also, that if XYZ person is feeling low or feeling in a certain way, then you can ask some question from that person, and you can simply suggest them that right now I think there is a need to change the environment. So, I'm just going to give you one example. For example, you just finished with your exam, and when you just finish with the exam, because you were having a lot of stress on your mind during the exam days, so everyone wants rest after the exams. So that means why we need rest, so that I can understand that I cannot study now, there's already so much pressure on my mind for the exam. Now I need a break. It may be that I need a break for 1 day or 2 day, but yes, I need a break. So that means it is going to help us how and when to change the environment. Then the fourth point where this subject is going to help you, it is going to throw light on the light of the interdependence. Means with the help of this subject you will be able to understand your body, mind and soul. Here, the meaning of soul is related with your inner self, and that means when most of the time we are not aware about this fact, that if I am feeling in a certain way, and for example, mood swings. Sometime the reason of mood swings is your hormone thing. Sometime it may be that there is something that is going in your mind, and that is affecting your behavior. So in the second unit, basically we are going to understand your body and mind relationship. Means if there is something that is going in your body, definitely that is going to affect your mind. I'm just going to give you one example. For example, you have pain in your body. Let's say you have pain in your stomach. Now, if you are in a class, you have pain, will you be able to concentrate? No, you can try, but yes, if you have severe pain, definitely it is going to affect your concentration. So that means, yes, body is connected with the mind. The similar thing happen with your mind. If you have some kind of stress or tension in your mind, then slowly and gradually it will start affecting your body also. For example, if you are going to think about a thought for a certain period of time, slowly you will start feeling some pain in this area, or it may be that you have some kind of body pains or stomach pain. Your metabolic system is going to work fast or slow according to your body level. So that means, yes, with the help of, of psychology, you will be able to understand the relationship between your body, mind, and your soul. The last, that it is going to help you to adjust oneself. When you are going to study psychology, you'll be able to understand this thing, that yes, as a student nurse, as a staff nurse, you need to make a number of adjustment in order to work effectively and efficiently with other people. It may be that sometime you need to adjust with the new environment. uh, uh, you need to go somewhere that is a new home. It may be that you need to live there in the hospital for a certain period of time. It may be that you need to adjust with the different patients. They are suffering from different disease conditions, different age groups, and you also need to adjust with different work routines. So this psychology subject is going to help you to adjust yourself according to them. And yes, when you are adjusting yourself, then yes, it is also going to help you in the development of a professional personality, so that you can perform in a best manner. So this is all about relevance of psychology in nursing. So let's do some practice uh, in MCQs form. Psychology word is derived from, yes, the answer is two Greek words. Yes, the answer is Greek. Psychology is a scientific study of human and animal behavior. Then the structuralism school was given by, this is the first school, and that is given by William Wundt. The word gestalt means whole. Introspection means intro, self, spection, observation. That is self observation. Observation should be conducted in, I have already told you, that is in natural setting. In the experimental method, the hypothesis can be defined as, yes, presupposed solution of the problem. Which method is more suitable for animals, children, and mentally challenged people? Observation method. So this is all about unit 1. If you will have any question or doubt, then you can ask from me in the comment section. I'll give the answers of your question. Thank you so much. Take care. Bye bye.